Hey, we'd like to welcome you all again on the Tech Factor podcast with Purple Quarter. We have Vikalp in the house. Thank you so much for joining us, Vikalp. Thanks for making this trip to our office.
Thank you so much for inviting. It's a pleasure to be here and talking to you.
Awesome. So, for people who don't know you, Vikalp, I think most do, but I'm still going to say that for people who don't know you, I just wanted to talk about that you did your NIT and then you moved on to IBM for a very small
Yeah.
bit for 9 months or so.
Yes.
And then it has been a Go IBBO journey for you.
Yes.
And you took off from there from a CTO co-founder to start your own firm.
Yeah.
Right?
Yeah,
From a
it is.
travel to a completely different health domain.
Yeah.
Now, that's a huge transition for you.
Right.
So, can you talk about being a CTO co founder? That's one piece I'd like to ask you, to becoming CEO, and also the shift in domains. How did that happen for you?
See, I think I'll take the second part first, maybe. Why from a CTO to a CEO and what conspired. And the whole idea for me was to build a tech organization right from a ground up. And I think thanks to all of my leaders that I've worked with earlier, I got a lot of insights about how orgs are being built, right from my IBBO days to pivot to Go IBBO and then Go MMT, which was a mega merger in 2016, 2017. Learned a lot from that large merger and then led a large team. I thought that now is time to again go back to those roots of building something from ground up. But this time, try to taste how a tech organization can be built. And I've been in awe with many of the valley-based tech organization that has been built by like technologists.
Right.
And I consider myself a technologist, maybe not as great as many others, but I would like to call myself a tech guy, a developer. So I thought that it would be a good transition to basically be a CEO in this new journey of mine, where we can fundamentally think about how technology can solve problems and then businesses are built on top of it. So that's why that transition, which is because of my focus towards tech and building tech-led products. From travel to health, the very simple answer is Aarogya Setu. But the detailed answer would be, it was in 2019, I thought that I'll start something new. I started discussing with Deep and Rajesh, Go MMT leaders, and Ashish later, and started discussing about a travel idea.
Okay.
And then a little bit on fintech as well.
Sure.
But eventually I thought that travel is my house, it's my comfort zone as well. I should do that. And there are lots of interesting innovations that we can do on travel, again, tech-led. But in 2020, when this whole COVID came in, it was not necessarily because COVID and travel doesn't go well together. The idea of Aarogya Setu, when it started happening, resulted in giving me a lot of insights about what health is and how broken it is.
Sure.
So some of these questions started coming up to me, which is like an example. Today, if anyone wants to have a date, right, in 5 kilometer radius, it's so easy, right? You go swipe left, swipe right, you might find a date. But let's say you want to have a blood donor for an AB positive blood.
Very true.
How would you get it? I mean, it's so hard.
Right.
People travel all the way from Northeast to these places in Whitefield,
Right.
Sai Baba Hospital or a Vaidehi Hospital. It's written in English, Hindi, and in Bangla.
Okay.
Because people travel all the way from there to get themselves tested and consult a doctor. But sitting there, they can easily do YouTube, TikToks of the world. But a doctor consultation is not still ubiquitously available.
Correct.
Many such things started popping up in my mind while we were developing Aarogya Setu. My father, he's a diabetic. He takes his diabetes reading and he writes it in a piece of paper.
Okay.
And then he gives it to his doctor.
Sure.
And the doctors, they anyways are stressed for time. They are looking at that piece of paper to marry these. While you and I, we look at revenue numbers in a nice graph, which is like super looking and it can give us insights. And I believe that, okay, health is not solved.
Wow, these are just basic problems we're talking about.
Super
right?
basic, super basic. And that practically resulted in moving from travel to health. And I think I firmly believe that I used to tell this to people in travel. We give people a way to have happiness, like go out, travel with your family. Here in health, you are letting people live a good life.
Sure.
So the far more impact that we can create on health.
So beautiful.
So that's how the whole transition from travel to health or from CTO to CEO happened.
Sure. CTO to CEO is great because I think you fit that pretty well, because you have a tech first thinking mindset. But health is a bold move, I must say.
Yeah, it is.
Because, like you rightly pointed out, it's quite broken.
Yeah.
Now, could you tell us some more problems that you may have found, which is why today there is, you have built
Yeah.
this company
Yeah.
basis that.
So when I started Rupa, I never thought that this will be this big a problem. To be honest, I just knew the tip of the iceberg. These are the tip of the iceberg, right? When what we spoke about, what I realized at that point in time. But the basic infrastructure is so misaligned that the incentives in the entire health ecosystem is not properly being fit. I'll give you an example. I fundamentally believe that today, doctor's time is the most important
Correct.
thing, right? He is the one who's the final caregiver. From there, everything starts. But you pay the least to doctors for his time,
Okay.
right? Which means that if today, if you're paying a doctor 200 rupees, an average consultation size in country for doctors 10 minutes is not more than 150 to 200 rupees. That's not right. But you pay far more to a tertiary care who basically is more like trying to give you the business outcomes, right? Or a lab where for a 20 rupees or a 30 rupees test, you're okay to give 600, 700 bucks.
Correct.
But you're not okay as a consumer to give doctors a right kind of a consultation fee. I believe that's not right. So fundamentally, there are many such things where I feel and I've learned that the incentives are misaligned.
Sure.
Now there has to be a platform. I'll give you another example. There's an MRI scan that you can do from 2,000 rupees to 20,000 rupees, right? It's very different. But the experience of MRI is very simple. You go there, 20 minutes, you sit in an AC hall, then you go inside a chamber where there is a machine. You have to sleep, lie down there for 20 minutes. It's much more standardized than an Uber experience where you are going from Whitefield to, because there can be different types of cars. There are only 3-4 types of MRI machines.
Correct.
But you have a differential pricing from 2,000 to 20,000. Why?
Correct.
There's no transparency. There's no right alignment of incentives. And if that fundamentally happens, if people start aligning these incentives right, I think it'll be far more impactful for the ecosystem. And it will happen. It is something that is imperative, right? There are many industries where all of this has happened. Health is, I think, the last frontier where this must happen. And we want to be part of that change.
Awesome. So, how is ACKO going to be helping us through technology to solve for some of these basics?
See, one of the things that we are, as I said, for us, two constituents are the most important in the ecosystem. One is patient, obviously,
Right.
you and I, where we want to keep your medical records on a single place.
Sure.
We want to make sure that your health profile is there at ACKO. We want to make sure that, like another story, my sister, she got to know that she's a thalassemia minor when she got pregnant.
Okay.
She could have got it much earlier if doctors would have got a system that can show a longitudinal trend of her iron deficiency.
Right.
And knowing that at the time of pregnancy is a disastrous experience, right? Because it can reflect badly on the kid. So we want to be the health profile so that Roopa, Vikalp, all of us can basically have our longitudinal health journey on a single place, which is what a personal health record app should do. On the other side, we want to work with doctors because you won't self-medicate yourself, right? If your vitamins are low or if your iron is deficient, you won't go to a pharmacist and start basically popping up medicine. Doctors must get this information. So we've built an EMR, which is a clinic management system where we are focusing deeply on prescription creation and also on appointments, because that closely ties in with the connected care that we want to build.
Right.
So these are the two products that we have delivered,
Sure.
and we have seen like commendable traction there. I think keeping my fingers crossed that it should continue in the same way. So and without much of a marketing. On top of this platform, which is where the doctors are writing prescriptions, holding appointments, and patients keeping their medical history, we want to build use cases.
Okay.
But our use cases will never be something like find a best pediatrician in town. Like, we don't believe in best pediatrician. We believe in Roopa might have a best pediatrician for herself, and Vikalp, it's a subjective knowledge. It's not like the selling hotels, that this is a 5-star hotel, this is a 4-star hotel. Doctor and patient relationship is far deeper.
Correct.
Than just like few stars, and it's very subjective.
Sure.
So we will focus on building that from both doctors and patient perspective.
Awesome. So has COVID actually triggered layman to think of health more consciously, or was it like we live in a fast food world, things change so rapidly, so COVID's forgotten, so we back on how it is. What are your thoughts?
No, it absolutely has changed. COVID has definitely changed. If you look at the numbers, the number of people going for a self-tests has increased dramatically, right? People go for a regular health checkups nowadays, every 6 months, every year, maybe for elderlies every 3 months, and so on and so forth, which is one fundamental change. We have seen without marketing, ACKO has been able to garner a lot of interest where people are coming in and storing their medical records.
Wow.
People are coming in and doing their heart rate checks. People are coming in and talking about their problems with our symptom assessment engine. And that coming in without much of a marketing it basically states the fact that people are now getting a lot more aware.
Sure.
And I think all of this has changed because of COVID.
Understood.
So it's a big change
Understood.
that
Understood.
COVID has brought in.
Great. So, since we picked the topic of COVID, I wanted to actually talk a little bit about Aarogya Setu as well.
Yeah.
Right. For a lot of people who don't know, and I got to know when we met last that there was a
Yeah.
team of 20, and
Yeah.
you guys were the pioneers of building this entire thing.
Right.
How did it all come about? How did you think of this? And
No, see, it was a very simple story, and we were talking about Rahul earlier. Rahul was part of my team at that point in time.
Right.
He was a key guy behind Aarogya Setu. So it was between few of us. We saw one newspaper article in Kerala. That was when the first COVID cases started appearing in Kerala, and it was like a article where it says that if you have visited all of these places, please come and visit one of the public healthcare centers to get yourself tested.
Correct.
Because a COVID positive patient has visited all of these places in last 7 days. And we said that it's so hard. You cannot basically scale this thing up at all. Is there something we can do using tech? So yeah, as
this
I
is
said,
like a coffee discussion.
this is a coffee discussion. This
Okay.
was like me, Rahul, a couple of others in the team, Go Vivo, we were discussing about it. And we said that, okay, let's do GPS. Let's start something. We can help. We can solve. And then that resulted into going far more deeper into tech. In COVID, proximity is far more important. Let's do Bluetooth. And at that point in time, there was no Blue Trace in Singapore. People were not even thinking about this.
Okay.
And we built a small POC.
Okay.
A very small POC, which was like in a room. It was my cabin where one of the Android developer came in. He developed something. Me, Rahul, and many other guys, we just came in and we said that, okay, it works. We get to know about the proximity of individuals.
Okay.
And then we just shared it with Deep. Deep shared it with, Deep is the CEO, chairman, Make My Trip. He shared it with Niti Aayog. They loved it. They were actually thinking of something similar at that point in time. And they invited us to start building it up full-fledged. And thanks to Government of India, to be honest, they did robust and massive testing. IT Chennai worked with us to do testing.
Interesting.
They brought in more people from the industry to actually help us in bringing it together. Every entity in government, be it NIC, They helped us wherever we found problems, for example, SMSs and so on and so forth. So it was like everybody working together for a common goal to solve for the citizens.
Sure.
And that's how it all started. And I mean, we were lucky to be part of that central team that was building that product, and everyone was supporting us. And I think whenever I talk about
You
Aarogya
get
Setu,
goosebumps?
goosebumps. Yeah, I get goosebumps.
I am getting them too while you're
As a
saying.
developer, you can't have that kind of an experience ever. We 25 of us.
Sure.
We were so motivated while doing that. I remember there was 25 of us. It was all remote at that point in time. And there was a video government has released about how doctors are fighting in front for COVID as a COVID warriors. And we felt that we were also part of them.
Oh, okay.
That we are also COVID warriors.
Sure.
I remember those emotions running on each one of us, and building at that scale with 17, 18 million downloads happening in a single day. I think Aarogya Setu will hold that record maybe forever. 50 million downloads in 13 days. The second best was Pokemon Go in 19 days. So I think as a developer, it was a
real
fantastic
high.
experience.
Yeah, I can
And
imagine.
the impact was also pretty big.
I think it was very much needed for that point of time, and I think I should give it to all of you. And I don't think too much of kudos has been given to this team of 2025.
No, enough of it. Roopa. I think we are humbled with the kind of, we got, people spoke about us, including the government. People say a lot of things about government, but the way they execute, I was flabbergasted.
Interesting. Lucky you say that. So I'm just going to come back to our first part. Thanks so much for sharing that piece, because I really wanted to talk about it in this podcast and say that, hey, there is a face also to the Aarogya Setu. So I just wanted to make sure we talk about it. But coming back to, there was this question running on my mind. You said that my records can be held digitally. Now, digital can be put in multiple formats, right? That is, I'm just scanning, that can also be called digital records.
Absolutely.
So retrieving them may not be as easy if I'm just going to scan and upload them.
Yes.
So how are you guys making this difference?
And you hit the nail on the dot, Roopa. A personal health record app cannot just be a Dropbox or a Google Drive equivalent, where you are just taking a picture, keeping a record, or keeping a PDF and storing it there. The personal health record app should understand about your vitals, should understand that how your hemoglobin is moving over a period of time.
Sure.
And that is what we basically are have built. So when you scan a record, there's a technology that runs, and there's a data science team behind it that OCRs that entire record, be it a scan or a PDF document, understands the nuances of all your vitals. Make sure that the record that you got from Dr. Lal or the record that you get from Metropolis, all of that is standardized. And then your health journey is created.
Okay.
Because that is where the technology can add value to doctors' lives or to the patient's life.
Right.
It cannot be just a mere scan of your document. It has to be far more deeper. And then the nuances on top of it. Like if you are vitamin B deficient, can I basically help you in creating a journey along with the doctors where you are eating right, where you are getting yourself tested again and again so that you get better over a period of time.
Right.
So that's a very big nuance that technology has to solve from a health record perspective, and it's just not the storage of the scan and then the photo.
Right.
It won't cut the chase from the impact perspective.
So are you saying that, for example, if I get my ACKO and the treadmill test, generally when you go through your life insurance and stuff, you have to get this done.
Yeah.
So you get it done, and then you're saying your team will be able to predict when I might have a heart issue, if at all, in the future. Do you think that is possible by eka?
No. So eka will. So I keep telling you, eka is an information company. We are not a prescription company.
Okay.
We are not doctors.
Right.
And AI cannot replace what doctors and their subjective understanding is. We want to aid in this journey.
Understood.
We want to tell you that your heart rate at resting is constantly up. As per the WHO standards or as per the regular standard, it has to be lower. Now, how you react to it is something that you have to take a call, and you have to go ahead and speak with your doctor or your physician and all.
Understood.
See, what we also felt in health, it's very easy to be imposing and instill fear, right? Because everybody, a very nice saying, when you are healthy, you think of 10 things, but when you are sick, you think of only one thing.
Yeah.
And it's very easy that when you are sick, I can go ahead and manipulate you.
Correct.
So that you end up paying and you end up basically manipulated, right?
Sure.
So we say this as in eka, that's what we tell people, that we want to be authentic and not imposing. Never ever we will say that, okay, you should go ahead and get yourself tested for this. We will give you authentic information. Now it's you and your doctor's prerogative, because today the lack of information is where people won't get the right outcome.
Correct.
So that's a subtle difference
Understood.
between what we want to do to what is happening in the ecosystem.
Sure. Do you see in future where there could be joint ventures, or where you have an alliance with insurance companies? Because
Definitely.
there
I mean,
is-
you spoke about getting a life insurance or insurance. It's so painful activity, right?
Correct. Yes.
Today in this world, when I can buy an auto insurance, maybe by in a 2 days flat with a single clicks and
Click,
all of
yeah,
that,
yeah.
health insurance or life insurance is very difficult.
Correct.
A solution like us can definitely help aiding that, for sure.
That is excellent. So, if before we just started this chat, you talked about why you called the company eka.
Yeah.
So, would you mind telling
No,
your
it's,
audience?
it was a fun conversation with the team. It was whole team that ended up getting this name. Eka means unity. Eka also means one. It's like
Right.
first, right? And Eka is 3-letter word, and Eka is also something very Indian, right? It gives you that Indian feeling, the Sanskrit and all of that. So these were my requests to people, that it should mean something nice around connected care. It should carry Indianness to it, and as small as possible. So, which is 3 letters is the best we can do.
Sure.
So Eka came out of that, and Eka means like we want to connect people, which is the care providers and the person who needs care
Right.
in the right way,
Sure.
so that there are better health outcomes. And I think that what Eka and the unity around Eka signifies.
Sure.
But it actually also says that when it's about health, it's about you, right? When you look at your finance, right, it's about family, right? Your family's finances are together. But when you look for health, you have to take care of yourself as well, because your health is very different from your partner's health, or very different from your parents' health.
Correct.
When my mom, she's an individual. When we are talking about finance, my mom and my dad are together.
Right.
But when it is health, she is a very different being.
Correct.
So that's signifies one.
Wow, very, very interesting. I think it's very driven towards the vision that you have for the company and what you guys want to build. Right? I love the part that when you started, you said tech first as well. I can see that when you talk about how this is going to transform how we're going to look at our own health reports.
Yes,
Right?
yes.
On that thought, because there's going to be so much of data
Yes.
that will be stored on this platform.
Yeah,
Right.
yeah.
And I haven't used it, I'll be honest. I will,
Yeah.
after this show, I will download eka, right?
Yes.
But the whole piece I wanted to check with you, and it's so much happening around data breach.
Yes.
Data security becomes a prime aspect,
Absolutely.
right? So could you tell us what is it that eka is doing differently?
Yeah. So see, and I'm a big promoter myself of privacy, encryption. As a technologist, if you look at 90%, 95%, or maybe 100% of the tech first folks will always be a proponent of privacy, because they understood how easily individuals can be manipulated if the data is not kept safe. And I think that is what we followed at Aarogya Setu as well. When we built Aarogya Setu, it was very client heavy.
Right.
We basically said that use Android and iOS as an ecosystem so that your data is in your device, it's not even in the cloud. So, and these are very, very bold and strong premises that we had built, and government agreed that this is how it should be. Even we don't want to snoop around people,
Right.
which was something that came out in the wild, that Aarogya Setu is snooping around, but it was just the contrary. If you look at the architecture, it was very different.
Sure.
So that's what we have taken up and also doing at eka. So one of the things is, obviously, if you want to create value for users, you have to do processing on this data. If you want to do that processing, you have to use backend and client and all of that together so that you can give the right kind of a value. But what we do is we give people options that whether they want to do this particular act or not.
Okay.
I'll give you an example. Google has approved us that we can go ahead and scour Gmail boxes of users
Okay.
if they approve
Sure.
to find medical records so that we can keep it there.
Right.
Now it's very easy. If a user gave access to go ahead and get all kinds of Gmail records and then do all kinds of activities. And today, by the way, 3,000 people, they give us every day these accesses and all of that. Now, we said that this is a very important and a personal data. How can we solve for it? So we are now tweaking our architecture a little more to say that now you even can say that I only want emails from these addresses.
Wow.
To be downloaded and not necessarily scour my entire mailbox. So we are giving power back to users.
Sure.
Right? There's a new feature that is coming in on medical records where we are building a personal vault kind of an experience.
Okay.
Where you can have a medical record that you don't even want anyone to see.
Okay.
Right?
Okay.
How can we solve this technically? Now, technology has evolved. What if I give you, Roopa, a capability that there is this document that she's so uncomfortable even to store in a place where it can be read in cloud?
Sure.
So your document in Vault will be encrypted locally, like any blockchain or any kind of a locally encryption system or an end-to-end encrypted system, where you own the key that only you knows, not even eka. But this encrypted document is backed up in the cloud.
Wow.
So that when you need it, you can get it. But we cannot read it. No one can read it.
Sure.
So those are the kind of features that we are putting in front. And I don't want to talk about simple things such as we constantly do our reviews with Google's approved security advisor. They check eka's platform because they give a certificate. We are CoWIN and ABDM certified, so certain also employ people to check our systems, whether we are doing everything in terms of security right and so on and so forth. So yeah, hardening our systems for security is one thing, but building an architecture where users are in control of what is it that can be seen by you, what is it can be seen by eka's machines, so that we can give you right insight. And what is it that you want to share with your healthcare provider?
Sure.
At 3 level, we will basically are creating a consent artifacts.
Right.
So that's how we are solving privacy and security. And I think there's nothing, even financial data is not as private as a medical data. It's like written on the wall that medical data should be kept super, super carefully. I mean, we owe it to people.
Sure. So, since two things that come to my mind. I'm sorry, I'm just listening
absolutely.
and have these questions. So, if you were saying that this data is available to me as let me say I'm the patient, so I have all the data that is available. Does this get ever integrated with the doctor's database so that, if and you rightly put while we were discussing first, so the doctor-patient relationship is based on trust. So I'm not going to go to like 10 or 15.
Exactly.
Right? So maybe narrows down to 2 or 3 depending on what I have.
Yes.
Yeah. And those 2 or 3 will know my condition. So if this is already readily available, I don't have to explain myself the next time I go because it's already there.
Yes.
Right? So does it get integrated with platforms outside?
Exactly. So 2 things happening. If it is eka to eka, again, if you as a patient are giving a consent that you want to share these specific documents with, let's say, Dr. Vikalp. I mean, I'm not a doctor, I'm just using it for the sake of it.
Sure.
Then you can share seamlessly.
Okay.
But there's a fundamental change that is happening in the ecosystem as well. So government is working on something called ABDM, which is Ayushman Bharat Digital Mission.
Okay.
And government is creating something called Aabha IDs, Ayushman Bharat Health Account, which is very similar to UPI IDs.
Oh, nice.
And the plan is that all of this should be integrated. So there should be Phone Pay, Google Pay kind of apps. And that is what eka.care's vision also is, that can hold users' medical record. And there will be hospital systems or systems that doctors use where they can access these records provided the consent is given by that particular patient, and an interoperable system.
So like a QR code, and I just like...
Exactly. You
Wow.
go to Eka app, so when you download this, one of the things that you must do is create your Aabha ID.
Okay.
And you will see a QR code.
Oh, nice.
And you can go to a Jayanagar hospital and you can show that QR code. When you show that QR code, all your medical documents will be relayed to Eka.care without even you basically doing any kind of a hard
Oh,
work.
this is interesting.
I mean, if you use Eka.care, if you have health ID on Eka.care, when you go to a booster dose, you get your COVID certificate, you get your COVID shot. As soon as you are done with it,
It's downloaded.
digitally, your record will be delivered on Eka.care if you use us as your PHR app.
Oh, nice.
So that is also something profound that is happening, and I'm keeping my fingers crossed that this should happen faster sooner than later, because this will fundamentally solve whatever we are talking
Absolutely.
about.
Do you see the use of blockchain at all to whatever you're saying?
See, definitely, blockchain as a technology can have multi facets to it. Whatever we are doing, we are not using those artifacts at that point in at this point in time. There could be, what I would believe is, blockchain for storing simple files is an amazing idea, and people should definitely do it. But extracting meaningful insights is where I grapple my head as a technologist, whether I can leverage a blockchain for that or not.
Understood.
So blockchain fundamentally will solve many of the tech challenges and problems and concerns that I'm pretty sure of as a technologist. But how it will get used in health is something that time will tell.
Okay, all right, that's interesting. So coming back to the number of Google downloads that Eka has. So we see that, hey, you guys, 1.5 years since you guys started.
Yeah, so June 2021 is when we launched. Yeah,
right.
it's been a year and a half.
Yeah, a year and a half. So how did you phenomenally see that this is going to happen?
No.
Or where does your customer base, are they all in metros? How is it going to the rural side of the world? I'm super curious.
See, we have, today morning I was in a review, and that review was that we have crossed 5 million downloads
Wow.
on our Android app, and iOS is also growing pretty fast, and we all clapped for it. So it's an apt question
Congratulations.
for me. Thank you so much. I mean, I think the users that, see, one of the things that I definitely want to say is that I have the smartest team in the country. So,
All right.
bang on. And these guys are the ones who are getting all of these users for us by building the right kind of a solution. For example, today we host close to 30 million. We have served 30 million users COVID certificates. COVID certificate is an important document. And you want to have that document for yourself. And the experience that the team has created is so good that today that gave us a lot of eyeballs from a user perspective. And these users eventually get Eka, and they explore Eka, and then they like other things on Eka, and then they start using it.
Nice.
So that's one big area. I mean, doctors are also helping us. We build softwares for doctors, but that prescriptions gets delivered to patients.
Right.
And if patients feel that they would like to keep that prescription and other records on Eka.care, they basically use it, and then Eka gets users and all of that. Also, we keep chatting about us in social a lot. We did a little bit of a marketing earlier, but now we stopped it because we feel that we are getting enough eyeballs in general. So we are good with it. And these kind of many growth hacks to value for users is what the team keeps on doing.
Sure.
And I think it's I mean, eventually I would say it's my team's magic. They obsess about creating the right medical experience for the users.
Interesting.
And my job, that's why it's super easy.
I'm sure it's not, but that's really sweet of
No,
you to
no,
say.
it is. It is. I mean it. I mean it in my bones. It's. I tell them also quite often that it's. These guys are phenomenally competent and ambitious to solve for it.
No, I'm sure they enjoy working with you, Vikalp. I think I will not take that away. But you have what, like 150 member now?
No,
That's
no.
what you have shared.
We are now we are touching 100.
Oh, 100
including 100, 110, including and some bit of sales and because we need to work with doctors. So we
Right.
have presence, sales presence in 15, 16 cities where we closely work with doctors and solve for them. So yeah, touching 100, it's like I never realized that we will be 100 so soon.
No, I'm sure you guys are doing some brilliant work there. While you were talking about these doctors, I'm sorry, I keep going back to what you
Yes,
said,
yes.
right? But while you were talking about doctors, do you ever foresee a voice recognition to get added into your tool? Because instead of writing prescriptions, writing down notes,
Yeah.
do you see this actually getting onto the app directly?
Yeah. See, I fundamentally believe that it's all about a technology so mature that it can solve for that particular practical use case.
Okay.
Think about handwriting recognition, right? Doctors today write prescriptions,
Yeah.
and people are doing a lot of work on handwriting recognition. Why do we even need a voice?
Correct.
Right? Doctors are writing it on a piece of paper, and then it just recognized, and your medical history gets created. Technology is far from it. We don't
Right.
have the right tech that can reliably do it. Similarly, on voice, I feel that, and all of us use Alexas to echoes and all of that at our place, it's not reliable enough
Correct.
to have a very important note, which is a medical document, to be kept into an EMR.
Correct. Correct.
That's the state now.
Sure.
Will this state be in 5 years from now or 10 years from now? I don't think so. And if you ask me, I believe it won't be the same. There will be far better technology that can improve the user experience of doctors. And sometimes my heart is with them. I mean, they have to talk to a patient. While they are talking to a patient, we are asking doctors to write on
On
an
a system,
EMR as well,
yeah.
on a system. And then I mean, you and I, we spend 8 hours in front of computers. Doctors spend large amount of time talking to people and
Correct.
operating people.
Correct.
I mean, we can't expect them to type as fast as we do. So this
Yeah.
is like wrong expectation.
Sure.
Technology should solve it. Today, we are not there yet to build the best experience for doctors. We are trying whatever today is available best from a tech perspective. But I mean, to solve for doctors, it's a long road ahead. It's a long road ahead.
Okay, we'll wait for Eka to solve it because I'm looking forward that happens. So, can you tell us what is it that you are, if people wanted to come and join Eka, I'm sure they've heard this on what you're trying to build. It's super exciting. What would you like to tell them? What are the kind of, what are the few values you look for?
See, and these are the things that I personally also carry, and I believe that whatever you carry, I mean, you constantly advocate. There will be a lot of people who would like to believe in them, a lot of people who don't want to believe in them. So whenever I basically want to have someone in the team, I say there are three things that, it's all in plain simple words. You should see if you've got enough learning opportunity. Like Eka is a place where you'll get learning. I mean, you would be able to learn a lot, and especially when it comes to tech product design. Very strong learning avenues. Second is we believe in empowerment.
Right.
We don't believe in, and I'm a big proponent of developer motivation. A motivated developer is, I mean, he's a different ball game, or he or she is a different ball game altogether. I've seen it many times in my previous stints, be it at Go Ibibo or Aarogya Setu, now at eka. So an empowerment comes, empowerment instills that motivation. So
Sure.
people will be empowered, because I want to feel empowered. I want to learn all the time. I want to feel empowered all the time. And the last but not the least is, when you look at it, the impact that you will create will be profound. Rest of the things like wealth creation and all of that is an outcome. Like, you will create wealth,
Correct.
but you'll realize that the impact that you are creating or delivering is profound.
Sure.
So these are three things that I value for myself. And maybe if people connect with these values, I think that's what eka and our team can offer.
Sure. So we will leave your, the social handles on this podcast for people to get in touch with you.
Wow, nice.
Or your team.
Oh, that'll be amazing.
We can do that for sure, because I'm sure a lot of people would be excited to come and join your team. I'll be honest. Right?
Absolutely. No, we would love to work with great people. Yes.
Awesome. So one last bit before we sign off. You've been a CTO and a co-founder. Now you're the main man on the ship, CEO and co-founder, right? So could you tell us, for all aspiring ones who want to become co-founders, founders, CTOs, CEOs, but the founding piece, right?
Yeah.
But was still in their mind thinking, should I not? They're on the fence.
Yeah.
What is that one thing that moved you?
See, to me, user and their problem is the core, and belief in that is the core thing that moves me. Business models, wealth creation, all of that is an outcome, right? But that user problem, a profound user problem, and if that user problem is large enough, right? And there can be smaller problems, there can be larger problems. That user problem is what you have to always hinge yourself on.
Sure.
That this is a problem. I want to solve that problem. That problem can take the solution to that problem can take 1 year, can take 10 years. Doesn't matter, right? And you have to be super sort of fixed. Like, it's written over there. I was reading it. Be stubborn on the long-term vision, but flexible on the details, right?
Right.
When you find that user problem, you actually become stubborn for the long-term vision.
Right.
And then you start basically solving for that problem. Everything else comes after that. But yeah, that's what I will basically see.
What is your advice
fixate
though?
it.
What is the advice for people who want to move to the other side?
To be an entrepreneur, see, again, be passionate about the user problem. And one of the things that I keep telling is to everyone, make sure that it's not you alone. One of the big advice that I tell everyone, you have to have a team.
True.
So when you said that, I am now spearheading, it's the other way around. To be honest, I wanted to start eka a little later. My head of products, he actually pushed me that enough of your sabbatical.
Okay.
This problem is so big and I'm so fixated to it.
Sure.
Why don't we basically start it now?
Right.
And I hold him accountable for not giving me enough sabbatical after my Go Ibibo stint.
Okay.
So you have to find that right set of people. It could be 1, it could be 2, it could be 10. But it shouldn't be that you alone are basically the messenger of. If you can, you can. I'm not competent enough to do it alone. But that is something that I definitely feel one should also look at while taking that entrepreneurial journey.
Sure. I think one takeaway I've personally had in this session is where you're giving it to a lot to your team versus, actually talking about your accomplishments. It's very humble.
No,
and
that's
very-
reality, Roopa. Why don't you?
I do believe you. But the whole piece is, I'm sure there's also a person who's leading from the front as well, which is you. And I want to acknowledge that as well, though you're not. So I'm acknowledging that.
No, thank you so much.
So it's been a real pleasure having you on our show, Vikalp. Would you
Thank
want
you
to
so much.
Would you want to sign off with last few words?
No, I think to everyone, please take care of your health. That's what we keep stressing about,
Sure.
and keep not only your health but your family's health.
Absolutely.
And yeah, that's about it. Have fun.
Sure thing.
Thank you.
Thank you so much, Vikalp. Thanks for being on the show.
Thank you. Thanks, Rupa. Thanks for the invite. Yeah.